The typical care that they're going to receive in like an emergency room or urgent care facility is, like right now in the COVID situation, I would tell a patient an Achilles rupture is very obvious. It's happened and you're going to get referred to a surgeon. And so I would just call the surgeon or your primary care doctor and try to avoid those critical service areas. In the post-COVID world, I would also advise that if you have an Achilles tendon rupture, ultimately, no matter what step you take, you're going to end up in my office or in a colleague's office to get surgical repair. And so, as long as there's no traumatic laceration or traumatic opening or some critical element, if it's just an isolated rupture, stay off of it, ice, elevate, call your PCP or call me and I'll get you in basically ASAP. Patients that call my office that have sustained an Achilles rupture, I just tell them, how fast can you get here? Because I want to see that patient, get them protected, get them immobilized, and then get them ready for their surgery. And so, not that urgent care, facilities are bad or emergency rooms are bad. You're just going to get a prescription for pain medication, probably a muscle relaxer, and then get sent on your way. Some facilities will do an ultrasound to confirm the rupture, but it's pretty obvious. I prefer MRI anyway because it really guides our surgical plan. And so it's just way easier to kind of save yourself the time, keep you protected. Because when you have the rupture, you're either at home or on the side of the mountain. You got to walk to your car, walk through the parking lot at the emergency room facility, walk back. The more you're on it, the worse the tendon retracts. And so I just say, go home, take it easy until I see you.